Hi, it's Jody Seeley, and today we're hanging out with Kathy Cooey from the High River and District Healthcare Foundation to talk a little bit about a COVID-19 community response. And over the past week, we've seen a lot of posts on social media of different things that has been going on in the community with the foundation. Tell us kind of some of the things you guys have done this past week.
Yeah, it's been a real interesting time, but there's been so many great positive things come out of it, and I really want to share one of the exciting initiatives that has come out of the COVID-19 campaign, and that is our long-term care unit. The staff recognized really quickly that it was really challenging for our families and their residents to not be able to engage with one another, and so as we speak, there is equipment coming that is going to set up a virtual visiting tool, and it will allow them to, on a big screen TV, interact with their family members. I was able to the other day see a photo of one of our residents interacting just with an iPad with one of their family members, and the absolute look of sheer joy on their face absolutely warmed my heart. And so I'm really looking forward to bringing that into place and trying to bring that connection back to our long-term care residents.
Well, and it's just become this time, I mean, because we can't have that physical distance with people, and especially those who are more high risk, is that you have to think of ideas outside of the box. So a virtual visiting station is really cool, and I anticipate they'll actually get more visits than they probably did before because people will be able to connect that much easier.
Absolutely, and I think it's a tool that we will use now going forward. You know, we often have outbreaks on that unit, and this is a way for us to continue to keep those families connected with them.
Well, and we saw also on social media this week that you took a social distanced visit to the local food bank. Tell us about that part of this initiative.
Yeah, that was the other organization that we saw in this community that is critical during this time, and we also knew that they were struggling, and so we wanted to help them. So we are supporting both the High River and the Nanton food banks with one-time donations out of the chute, and then going forward, 20% of everything going forward that we raise through the COVID-19 community response campaign will go to those two food banks.
And I think that's a really cool thing to note, because I know we've been made aware that food banks are really suffering at this time. And if you've taken your weekly trip to the grocery store, you see that a lot of the shelves are bare. So this gives people an opportunity to support the food bank by an easy quick donation on your computer from your home, and you know that it's going to go and support that food bank either in High River or in Nanton.
Absolutely. Like you said, we're trying to make this as easy as possible for those that have the desire and the capacity to support us during this time.
Now, one of the big pieces, too, of this COVID-19 community response is to give that support to our local healthcare team. And you had the opportunity this week to surprise them with morning tea and coffee when we were still able to bring that into the hospital. It was allowed then. Things have shifted and changed, so that's why we're going to keep you updated on the social media. But it was important, I think, for a little bit of morale. Would you feel that was the case this week?
Absolutely it was. You know, we were there on a few different shift changes, and I want to just do a quick shout out to our local Tims here, Kevin and Kim and their team there, who in the end donated all of the product that we serve to our staff, and it was exactly that, to try and lift the morale and keep the spirit up of those people working so hard in there under some great stresses that they've never had to deal with. And so I think it was really good. We had great positive feedback from that, and we're happy to do it while we could.
Absolutely. So moving forward, I mean, we don't know what's going to happen on a day-to-day basis with this. So this response initiative is set up for people to be able to donate to support that healthcare team, and then as the foundation, you'll sort of assess those needs as you go?
Absolutely. That is the key to this. We just don't know what's coming around the corner. As everyone knows, things change from day to day. You know, one of the conversations today was about the potential for some cots or comfortable sleeping units for staff that may have to stay within the hospital. And so that may be the conversation next week. But our plan is to have funds available to be able to respond to those needs as they come up.
Awesome. So people have the opportunity to be a part of the foundation's COVID-19 community response by giving a donation, and then you know that money is going to go to support that team and or the food bank. So how do people take part? How can we donate?
Absolutely. All of our contact information can be found at highriverhealthfoundation.ca. You can donate online. You can donate by calling us. We are retrieving those messages on a regular basis. And of course, there is the mail. And again, all of that information can be found at highriverhealthfoundation.ca.
All right, so stay tuned to the Foundation's social media for other ways to help. And then also, do you recommend a place for people to get accurate information? I know still, even this many days in, we're still seeing varying stories here and there. Where's the best place to get that accurate info?
Absolutely. I'm going to direct you to ahs.ca/COVID. That's the best place for up-to-date, trusted information.
All right. Well, thank you for the update. It's been fun to see the things happening on socials and ways for people to help. So if you would like to help too, go and donate now.
Thanks, everybody, and take care.